I come from the world of food and retail, and the last 20 years has seen the transition of the standards and technology has been prevalent in there now into healthcare in order to save millions of pounds and hundreds of lives. In the next 20 years, I would love to see some of the real pockets of excellence that we see around the country in Leeds, in Aberdeen, in lots of individual hospitals, transmitted across the whole healthcare network.
20 years of barcodes and standards in the healthcare and in the NHS is a long time, and I've not worked on it for that long. Honestly, the day cream is failing me, the wrinkle cream fails me every time. But ultimately what actually happens is that it just takes a long time. The NHS is made up of several hundred hospitals that all have their own chief execs with their own boards, and they need time to get on board with this. This is part of a massive roadmap of patient improvement, of facilities improvement. We build hospitals, we take old hospitals down, we improve hospitals. During that time, the standards actually need to become fabric of all those buildings, become fabric of all that strategy. And they don't, that takes time. Strategies are only generally published every 3 to 5 years. So you've only got one opportunity to do that. So the 20 years takes a while to embed, to understand, for people to recognise its importance. Going forward for the next 20 years, it would be great if we could actually embed them into the new hospital programme. That would be a massive start. But also if we can start to automate and leverage some of those tools that are trusted, that are used, and that perform to the same standards, perhaps without having to physically scan. RFID can do that. It can bring that piece. It can take, we can do 90 RFID under a reader at any one point of all the sterile trays, whereas we can do one scan in that time for a sterile tray. So if we look to automate, actually we'll embed and become much slicker at doing that.
I think for me it's about setting the standard. The NHS aspires to a level of control and a level of ownership of inventory that only the adoption of GS1 standards can give us. The past 20 years I think there's been a leadership role, there's been a promotion, there's been a communication, there's been a networking role. I think going forward in the next 20 years, it's about putting that into practice, delivering those benefits, and spreading the message that product identification is key to good patient care.
20 years, possibly not, but the last 3 years since I last came to the GS1 conference, I think we've made huge improvements. All of a sudden, we have a whole program on inventory management systems and point of care scanning, which a few years ago we didn't have. We have a medical device outcomes registry, which is able to be scanned into with the use of GS1 barcodes and a scan for safety system. These are improvements that we were only talking about just a few years ago. So 20 years ago, I can only imagine the gains that we've had since then. In terms of the next 20 years, as we talked about this morning, I don't know if we can see that far into the future, but right now in this government, we're talking about a change from analogue to digital, and GS1 barcodes and standardisation is central to getting that shift right and making it safe for patients.
So I've seen over the last 20 years some enormous developments in the use of GS1 standards, and I believe it's grown from strength to strength. What initially feels as though something very retail-based has really taken off in health and care. I speak from my own trust perspective, where GS1 standards are traceable within all of our systems, and that we can utilise those to help track our patients, help track products, help track assets, help our medicines management, and provide a real benefit to our patients. But that's been a journey, and it's a continuous one. If we roll forward, the use of GS1 standards should be globally across healthcare. It should be universal. Every system should be utilising the standard so that there's full traceability and there aren't interceptions within that data that break up that model. It should be seamless. I think that's the aspiration for every health and care professional. As a CIO, I think that's for me to ensure that whenever we're looking at technology, it adopts those standards so that it joins up the dots in our health and care ecosystem.
It's been 20 years. How is it we haven't done more, is the obvious question. And I think that probably undermines to some extent the bit that has been done. And so in this conference, we have heard from some exemplar sites that have done amazing things with GS1 standards, and I think that gives hope. I know that there's some amazing work being done by our supply chain and Sarah Ford and her team in terms of rolling it out. So by inches, we are making progress. I think what we're looking for is that sort of critical mass ignition that really amplifies this and takes it to the next level of delivery. I think that's what I hope for the next 20 years. And actually, let's not say 20 years, in the next 5 years.
So GS1 standards have been around for 20 years. I personally think one of the problems as a clinician is the word standards. We use standards a lot in medicine, and it often is off-putting for people because they think they might fail the standard. We're all familiar with iPhone tags, and if we fly Ryanair with trackers, I think GS1 standards are tags or trackers that allow us to trace the people, the product, what was put into somebody, when it was put in, where it was put in, by whom. And I think that has revolutionized healthcare over the last 2 decades. So over the next 2 decades, what I'd like to see is, I wrote a piece in the British Medical Journal in 2013 about, it was called Computer Says No, to boldly go to an NHS. It was a sort of parody on Star Trek. And I'd like to see us over the next 20 years truly go to an NHS or an NHS, a completely digitized health service where patients can see their own data, their own records. They can see it on their portable device, the way currently they can see their airline booking or their Amazon purchase. And that's got to be the way to travel.
I think it's been a great initiative, and it's moved, the mandation of the implementable devices which came last year, which was an excellent step forwards. I think what I see for the future is we need to stop looking at GS1 as just a tech or a supply management solution. We should look at that as strategical enablers to provide that smooth data transition between systems and provide that traceability which we currently lack. And if you have traceability, it's very manual, looking, searching, but it enables us to provide that digital, automated traceability, which I'm hoping. There was a lot of talk about mandation, and I think as customers, as one of the biggest customers in healthcare in UK, NHSs, we should use that power to drive the industry to adapt these standards better so we can, down the chain, carry that benefits across to our patients. In 20 years' time, I'd like to be able to track, trace everything, people, product, places, which is your 3 Ps, and ensure that all of that feeds into safety, and the whole look back from lessons learned and feedback will be much more effective if you have the data and the right data we can rely on. And I hope that provides that.